So let's start today's class. I would say it's an interaction uh, more than a class. You already had class on preventive orthodontics, but since there was some problem with the audio, we'll be repeating those classes. Those classes are in the schedule. So today's topic is preventive orthodontics. And this is something you are quite familiar with. Uh, this is malocclusion, you already know. That is irregular alignment of the teeth. So whenever there is malocclusions, a patient visit to our department, that is Department of Orthodontics. And what we do is we do certain treatment planning, extract premolars and put braces and wires and align the teeth. So this is orthodontics. So whenever there is malocclusion, we do orthodontic treatment. That is routine orthodontics. Today, we will not be talking about routine orthodontics. Our focus is on preventive orthodontics. So the whole objective is to prevent the malocclusion. So we are not talking about treating malocclusion, but preventing the malocclusion from occurring. So we will not see patients at an old age. We will see patients when they are very young. Probably at this stage, as you can see, teeth are still erupting. This looks like next dentition stage where the permanent incisors are just erupting. So we'll see patients at this age and we'll try to anticipate which kind of malocclusions this patient might have in future. And by anticipating those malocclusions, we'll try to prevent those malocclusion from happening. So when we get patients at this age, we'll examine the patients clinically. At the same time, we'll also take the orthopantomogram. That's why orthopantomogram is an essential diagnostic aid because it is a screening radiograph. As you can see, for the same patient, there are a lot of teeth in this various stages of development. So at this stage, we can anticipate what kind of malocclusion this patient might have, and we can prevent it. I think with this introduction, I have told you what we are going to study today. That is, we are talking about preventing the malocclusion from happening. And for that, we have to see the patient very early, probably in the mixed dentition, or at times even in the deciduous dentition, so that we can prevent the malocclusion from happening. Is this clear? It is very difficult
Yes,
to
sir.
interact with the screen. It's very difficult to interact, but anyway, we move further. So this is a question that I wanted to ask you. When is the right time for the first orthodontic checkup? We know that the right time for the first dental visit is around 6 months of age, isn't it? So when is the best time for first orthodontic visit? Anyone? I'm ready to wait for some time now. I'm ready to give some that uncomfortable pauses also. I want you to speak. So when is the right time? Can you guess the number for first orthodontic checkup? Anyone from the class? You can even use the chat function.
7 to 8 years.
7 to 8 years.
7 to 8 years. Yeah, that is correct. That is according to American Association of Orthodontists. The child should have the first orthodontic checkup before the seventh birthday. Before the seventh birthday. So what can happen is at that time the first permanent molars are erupting, the incisors are erupting. So at this stage, an orthodontist, I should say, can make assessment about the malocclusion that could set in this child and do some preventive procedures. So first orthodontic visit should be before the seventh birthday of the child. So there are certain idioms and phrases in English which I think have been coined for preventive orthodontics. One is a stitch in time saves 9. The other is an ounce of prevention is worth a pound of cure. And the final one is prevention is better than cure. So the whole idea of today's class is based on this theme. Prevention is better than cure. So this is the objective of our today's class, to understand preventive orthodontics. But from a more practical aspect, this is the objective of the class, is how to avoid orthodontic treatment for our children. And you are going to have children in near future. And then if you can avoid orthodontic treatment for them, you can save a lot of money. So if you pay attention in today's class, in future, you could be saving a lot of money. That is the objective of the class. But before we move on to the preventive orthodontics, this is a revision what we had, I think probably in the first class itself, different branches of orthodontics. Can anybody volunteer to tell what are different branches of orthodontics? If you remember, we'll wait for a few seconds. If you are ready. Okay, so these are the branches: preventive, interceptive, corrective, and surgical orthodontics. And we also know the differences. That is, if we do something before there is malocclusion, that branch is known as the preventive orthodontics, which we'll be discussing today. If we do something when the malocclusion is just developing, then that branch is interceptive. And if we do something when the malocclusion is fully established, there is a full-blown malocclusion, those are dealt with by corrective or surgical orthodontics. But today we'll do certain things and procedures where steps in. So we'll talk about preventive orthodontics. By definition, preventive orthodontics deals with the procedures which are undertaken prior to the onset of malocclusion. There is no malocclusion, but we'll do something at that point in an anticipation of developing malocclusion. So this is preventive orthodontics. And these are the things that we'll study today. The list looks exhaustive, but this is something that you have in the textbook of Balaji. But if you go through this, you'll know that there are a lot of things that you already know. So we'll just merely discuss about these things. We'll discuss these points now. The first aspect of preventive orthodontics is parent education. So what we have to do as a part of preventive orthodontics is we have to educate parents. Before I talk about different procedures that we do in preventive orthodontics, I would like to tell you that these procedures need not be done by orthodontics only. This can be done by general dentists as well. So the first aspect is educating the parents. So what we have to educate is we have to tell them how to clean their child's mouth, brushing the teeth or gum pad, cleaning the mouth. That is most important thing, because there is a direct relationship between caries and malocclusion. Malocclusion can lead to caries. At the same time, caries can lead to malocclusion. By brushing the teeth, the parents should be preventing caries in the mouth of the child. That would, in a long run, which we'll see later, prevent malocclusion. So the most important thing is parent education. So there are two things. One is cleaning the mouth. The other thing is regarding feeding, that is the breastfeeding. We should always advocate for breastfeeding and should try to minimize bottle feeding as much as possible. Anybody would like to tell what could be the advantage of breastfeeding over bottle feeding?
Decreased cases of early childhood caries.
Yeah, there could be early childhood caries due to bottle feeding. Anything else related to malocclusion?
There
Prognatic.
is the probability of leaving bottle for longer time in the baby.
That could lead to caries.
Proclination of anterior teeth.
There could be proclination of anterior teeth. Anything else?
One bite.
Open bite.
Diastema.
More important, diastema. But more important thing is regarding like the development of the palate. It is said that with breastfeeding, there is proper development of the palate and the perioral musculature. And if there is no proper development of the palate, the arch development is also compromised. So we should encourage mothers or parents to go for breastfeeding because we need proper palate for proper dental arch. So you just have to educate parents regarding two things: cleaning the oral cavity, and two is breastfeeding. So that is a part of parent education, because these simple looking things can prevent malocclusion in future. Second point, which is now related to parent education, but point number 2 is caries control. We should tell the parents to examine the oral cavity of their children frequently, and if they notice any caries or any discoloration in the teeth, they should report to the dentist. Because the caries control is important, and the most important caries in terms of orthodontics is the proximal caries. As you can see in this picture, this proximal caries at times is difficult to detect. Sometimes it is not visible clinically and it is only detected through radiograph. So it is important that this caries is detected, because if there is this caries, it could lead to reduction in the mesiodistal width of the tooth that can lead to reduction in the arch perimeter and arch length. Imagine the mesiodistal width of this tooth, the deciduous second molar is reduced. The first permanent molar migrates mesially, and in a long run, there will not be space for the eruption of second premolar. So the second premolar would eventually erupt either buccally or lingually, resulting in malocclusion. So a simple looking caries like a proximal caries can lead to malocclusion. So caries control is important. Sometimes if the caries is not controlled properly, it can lead to the premature loss of the deciduous tooth or teeth, as you can see here. If the anterior teeth are lost, the problem is not much in terms of orthodontic challenges or malocclusion. The problem could just be aesthetic, but if the posterior teeth like deciduous molars are lost, there could be severe space loss resulting in malocclusion in future. So point number 2 after parent education is caries control. Point number 3, again related to point 1 and 2, is care for the deciduous dentition. We have to care deciduous dentition. Why? Anybody could share their views? Why you have to care the deciduous dentition or the milk teeth? Anyone? 1 is for aesthetic reason. 2 is for function. It is for function, yeah. Function Vinamra, that is correct. And the most important thing in terms of orthodontics is to maintain the arch integrity, which I have already explained in caries control. That is, if the second deciduous molar is lost very early, the first permanent molar would migrate mesially so that there won't be any space for the eruption of the premolar. So there will be malocclusion in the future, which might require fixed orthodontic treatment, which is a very expensive treatment. So you have to care the deciduous dentition. So we have discussed 3 points which are interrelated: parent education, caries control, and the care of the deciduous dentition. These are the parts of the preventive orthodontics. Even though there is nothing in the patient's mouth, there is no malocclusion, we are doing these things to prevent malocclusion from developing. So this is the reason why you have to care the deciduous dentition. As you can see in this slide, can you see my pointer? Can you see the pointer?
Yes, sir.
Okay. So if this tooth is lost early, the first permanent molar would migrate mesially, and there won't be space for the eruption of the second premolar, which will erupt buccally or lingually, resulting in malocclusion. So you have to preserve the deciduous teeth. Deciduous teeth are the best natural space maintainers. This animation says the same thing. When the deciduous teeth exfoliate in time, the permanent teeth can erupt in the arch normally like this. But if the deciduous teeth are shed early, as in this second example, the first permanent molar would drift mesially, and there won't be space for the eruption of the premolar, which will erupt buccally or lingually. I have been saying the same thing over and over again. So it is important to care the deciduous dentation. So three things we have already discussed. The fourth thing as a part of preventive orthodontics is the extraction of the supernumerary teeth. As you can see in this example, there is a big gap or diastema between the two maxillary central incisors. And the cause is obvious here. It is due to an extra tooth. This is the supernumerary tooth. So a supernumerary tooth or teeth can displace the permanent teeth away from their normal position, resulting in malocclusion. So if we see supernumerary teeth very early, we have to extract them, as in this case. At times when you extract the teeth very early, when the permanent teeth are still erupting, this gap can be closed naturally without any orthodontic treatment. Sometimes the case is not fairly simple. As you can see in this case, clinically it will just look like space between the two maxillary incisors, but radiographically there is a supernumerary tooth or odontome between the two central incisors that is preventing the approximation of the two teeth. So in that case, again, you have to remove this supernumerary tooth surgically. If we can do this thing very early, when the child is in deciduous or let's say mixed dentition, I should say in this case, particular case, these two teeth would approximate themselves and you don't have to do any orthodontic treatment. So you'll be preventing malocclusion in a way, and you don't need any fixed orthodontic treatment in later years of the child's life. So extraction of supernumerary teeth is the next point, which we can do as a part of preventive orthodontics. As you can see in this example, this is the supernumerary tooth, and this is the permanent tooth that has been displaced this far labially. Had this been detected very early and extracted, probably this tooth would have erupted in its normal position, or at least close to the normal position. In this particular case, this might require orthodontic treatment. Extraction of supernumerary teeth very early in the life is a part of preventive orthodontics. So we have discussed 4 points. I think they are fairly simple and straightforward. Any questions at this point? Okay, I think there are no questions. So moving ahead, the 5th point is eliminating occlusal interferences. So as you can see in this diagram, there is a high point in the occlusion, and this is called occlusal interference. Because of this high point, there cannot be proper occlusion between the two teeth, maxillary and mandibular. These are also known as occlusal prematurities. This is mostly seen after restoration. If you had restoration, you would feel some high point at the end of the restorative treatment. Those are known as occlusal interference. So we have to eliminate the occlusal interferences. This could be a very important thing for you whenever you are posted in Department of Periodontics. Whenever you restore a child's mouth, it is important that you leave no occlusal interferences or the high points in the restoration. Because if you leave high points in the restoration, the child would not be able to bite normally, and to bite in a more functionally suitable position, the child would deviate the mandible to the right or left, which can lead to crossbite. So a simple looking high point in the restoration could lead to crossbite in a long run. So make sure that there are no high points in the restoration, or there are no occlusal interferences, because that occlusal interference could lead to crossbite, which is a malocclusion, and that might require orthodontic treatment at a later date. So eliminating occlusal interferences is a part of preventive orthodontic procedure. So occlusal interferences could be due to high points in the restoration. It could also be due to enamel palls, or it could be also due to prominent uh, cingulum of the maxillary incisors. If the patient has enamel pulse or prominent cingulum, probably enameloplasty can be done to eliminate occlusal interferences, because occlusal interferences can lead to malocclusion-like crossbite. And this crossbite-like malocclusion or even the occlusal interferences can in a long run lead to temporomandibular joint problems or TMDs. We do not have very good evidence regarding the malocclusion and temporomandibular joint disorders, but TMD cannot be ruled out. There is a possibility that if there is occlusal interferences, the patient could end up with temporomandibular joint problems. So point number 5, I should say, is eliminating occlusal interferences is a part of preventive orthodontics. Okay. Point number 6 is the management of the ankylosed tooth. At times we have deciduous tooth or teeth which are fused to the bone. You know what is an ankylosed tooth. The tooth is fused to the bone and there is no normal periodontal ligament between the tooth and the bone. So the tooth is fused to the bone, meaning the tooth will not be able to erupt fully in the occlusion. As you can see here, this is an ankylosed deciduous tooth and it is not able to erupt fully in the occlusion. It is also seen in this photograph. So what can an ankylosed tooth or teeth do? If you look at this orthopantomogram, these are the 4 ankylosed second deciduous molars. And because these teeth are ankylosed, the second premolars are being hindered from erupting into the occlusion. They will not exfoliate and they will not provide way for the eruption of the second premolars. So what will second premolars do? As I have told over and over again, they will erupt either buccally or lingually, resulting in malocclusion. How can we prevent the buccal or lingual eruption of the second premolar? By extracting the ankylosed tooth. So surgical extraction of the ankylosed tooth, or in other words, management of ankylosed deciduous tooth, is a part of preventive orthodontic procedure. Point number, I think it's 6. 6, yeah. So management of ankylosed tooth. Finally, we come to the abnormal frenal attachment. I think it's obvious to you, when there is high frenal attachment like this in the maxillary arch, it can lead to midline diastema. And if you can see in this case, there could be abnormal frenal attachment of the tongue also, which is known as ankyloglossia. So this can lead to difficulty in speech. The abnormal frenal attachment can also lead to recession of the gingiva with respect to the lower incisors. So whenever we see abnormal frenal attachment, those frenums should be released. So we can do frenectomy procedures. The abnormal frenal attachment of the tongue can lead to another malocclusion, that is the crossbite. As you can see here, whenever there is a ankyloglossia, the position of the tongue would be fairly low in the mouth. As the tongue is placed fairly low in the mouth, the tongue would not be applying force to the palate in the maxillary arch. So what can happen is, in the maxillary arch, the force from the buccinator muscle would be more than that of the tongue from the inside, which can lead to constriction of the maxillary arch due to excessive force of the buccinator muscle. So along with the maxillary arch, the maxillary molars would move lingually or palatally, resulting in posterior crossbite. So just because you did not treat the ankyloglossia early can lead to abnormal buccinator muscle activity, which can lead to posterior crossbite. So had you removed the ankyloglossia early, you would have prevented that malocclusion from occurring. So Addressing the abnormal frenal attachment, whether it is between the maxillary central incisors or it is a tongue tie, is another preventive uh, orthodontic procedure. Any questions till this point? Okay. This is fairly straightforward. We'll have a class on different habits. Probably you had it in periodontics. So if a child is developing any habit like thumb sucking, tongue thrusting, or anything like that, we know that these habits can lead to malocclusion like procline teeth, open bite, and so on. We have to stop those habits. So there are different procedures of stopping those habits. Probably we'll discuss in the chapter of habit, or we have already discussed in Department of Periodontics. So one of the preventive orthodontic procedure is eliminating the deleterious habits from the children. I will not discuss further on this particular point. This is another important point, that is the use of Milwaukee braces. You can see in this child, the child is suffering from scoliosis, meaning the lateral bending of the spine. So when a child suffers from scoliosis, one of the treatment options is Milwaukee brace. I don't know if this is being used these days, but we have to discuss this. So to prevent the bending of the back or the spine, the orthopedicians prescribe Milwaukee braces. And the problem with the Milwaukee brace is it takes support from the chin. So as it is taking support from the chin, what happens is there is reduction, or I would say retardation in the growth of the chin or the mandible. In this growing age, if you are restricting the growth of the mandible or the chin, in a long run, the child could develop retrognathic mandible. So child could eventually have a convex or board-like face. So with the Milwaukee braces, the scoliosis might be corrected, but it can lead to another problem, which is of particular importance for us, that is retrognathic mandible. So we should talk to the Department of Orthopedics regarding the use of Milwaukee braces, and we should try to find out another treatment option for correcting scoliosis so that it would not hamper the growth of the mandible. I think this is clear. Okay. I think this is the second last point, that is the managing the deeply locked permanent first molar. As you can see in this orthopantomogram, this first molar is locked beneath the distal bulge of the second deciduous molar. Particularly in the mandibular arch, the second deciduous molar has a prominent distal bulge, and at times the first permanent molar, which is erupting, is locked here. So if the child is taken to an orthodontist, or for that matter, a general dentist, at the age of around 6 or 7 years, and if the dentist does not see the eruption of the first permanent molar, he or she could recommend an orthopantomogram, and the finding could be like this. And if detected early, what a dentist can do is remove this part of the second deciduous molar, which is known as slicing or proximal stripping of the distal bulge of the second deciduous molar. And once that is done, the first permanent molar would erupt uneventfully. But if this is not done early in the life, then this first permanent molar could be impacted. So this is very important thing that a general dentist or an orthodontist can do very early in life, so that the impaction of the first permanent molar is prevented simply by removing the distal portion of the second deciduous molar. That is managing the deeply locked first permanent molar. And this is the final point, which we have discussed already. If for some reason the deciduous tooth cannot be preserved, At times, the deciduous tooth is lost because of trauma as well. In that case, we should use maintainers to maintain the space for the erupting post-permanent molar. So what you can do at this point is use a space maintainer so that the mesial migration or the drift of the first permanent molar is prevented and the succedaneous permanent tooth can erupt. Is it clear? So giving a space maintainer is another preventive interceptive procedure. So these are the things that we discussed in today's class. These are the ways how we can prevent malocclusion from happening. We discussed about parent education, caries control, care for the deciduous dentition, management of the ankylosed tooth. We have not discussed about the maintenance of the quadrant-wise tooth setting timetable. We discussed about oral habits. We talked about occlusal prematurities. We talked about Milwaukee braces, extraction of the supernumerary tooth. I think in the next class, we'll go into details regarding the space maintenance. We have touched onto this topic, but there are different types of space maintainers that we can use. We have talked about managing deeply locked first permanent molar and the management of the abnormal frenal attachment. Any questions you have? I'm ready for any awkward pause that can last for some time, but I would take your questions at this point, if you have any, or you want to add something. And this is something for you. You can read about maintenance of the quadrant-wise tooth setting timetable, which is one of the procedures, preventive orthodontic procedures, I should say. Any questions? I think there is a chat. I will just, I think I will stop share here at this point so that I can read your messages. Yeah, I think there is a question from Manisha, who is asking, how do abnormal frenal attachment leads to recession of the gingiva? Particularly in the mandibular arch, Manisha, if there is abnormal frenal attachment, that is, if the tip of the tongue is tied to the gingiva, particularly on the lingual aspect of the mandibular incisors, due to the movement of the tongue, the gingiva could move in a downward direction, leading to the recession of the gum of the mandibular incisors. Any other questions? Yeah, Akshita, I missed your answer. That is probably related to if there is breastfeeding instead of bottle feeding, there is improvement in the psychological bond between mother and the child. You're correct. But the most important thing as orthodontists is that if there is breastfeeding, there is proper development of the palate and perioral musculature. And whenever there is proper development of the palate, there is proper development of the dental arches, and there will be enough space for the eruption of the teeth, and there won't be any malocclusion. So the whole idea of today's class, which is, I think, 2 minutes, which will last for around 3 minutes now, is that what we can do to prevent malocclusion. So these procedures will be done well before there is any sign of malocclusion, in an anticipation of the malocclusion. So Akshita, the question is, you have to read about the quadrant-wise exfoliation schedule of the teeth. I think I showed you 12 points. Out of the 12, I have not discussed one point, that is one procedure of preventive orthodontics, how malocclusion can be prevented by maintaining the quadrant-wise tooth exfoliation timetable. Please read about that, which is given in the textbook of Balaji. At the end, I have one question. As orthodontist, why should I be teaching preventive orthodontics? Because if people follow preventive orthodontics, there won't be any malocclusion. And without malocclusion, what would an orthodontist do? That is my question. Should orthodontists be teaching about preventive orthodontics? Anybody would like to answer?
Sir, I believe, so to answer that question, sir, I believe it's not about the money. It's about treating the patients, and no matter how much we prevent the cases, there will still be other types of orthodontic cases to come if we could prevent this.
Yeah, that's right, Vinamra. That was the answer I was looking for. That is probably the difference between a businessman and a doctor. That's why we are in this noble profession. Thank you, Vinamra. Yeah, you're right, Akshita. As a good doctor, your aim should be to minimize patient. And no matter, as Vinamra said, whatever we teach, there will still be patients. And there are certain malocclusion which cannot be prevented. I think we are running out of time. I hope you learned something from this class, and I'll send you other links for the next class. Thank you so much.